Welcome to Innovate Retina. I'm Dr. Diana Doe. I'm here with key opinion leaders in retina, and we're going to discuss photobiomodulation. First, to my friend Bob Bisicle, tell me a little bit about how PBM is delivered to the patient, and are there pros and cons to that?
Yeah, I can speak as a clinician, as a retina specialist, someone who really wasn't familiar with the LightSight 3 study and this treatment modality, and so it was very interesting for me to see the top-line results here at Sonoma Eye. It's to be applauded because it's a novel modality. It has a novel therapeutic mechanism, and especially for patients with dry AMD, it is a non-invasive therapy, which might be more feasible, more viable for those of us in practice, and more importantly for our patients with dry AMD who, many of whom will be starting off with good vision.
As you mentioned, the top-line data from LightSight 3 showed that eyes that were randomized to photobiomodulation gained 5.5 letters of visual acuity at month 13 compared to sham treatment. Certainly, Judy, there are positive data from this study, but also other randomized clinical trials, specifically in the DRCR, looking at PBM in diabetic macular edema, did not have positive results. Can you share a little bit about that study and potentially, the pitfalls of PBM therapy?
Thank you, Diana. So Diabetic Retinopathy Clinical Research Network had done protocol AE looking at photobiomodulation effect on eyes with center-involved diabetic macular edema, but with good vision, 20/25 or better. And it was a phase 2 trial with 135 eyes of 135 patients lasting 4 months to see whether there was any anatomic effect decreasing the macular thickness between eyes that were randomized to PBM versus eyes that were sham. And unfortunately, it was a negative study. We did not have a difference between the two groups in that short period of time, 4 months. As a result, we are not going on to phase 3. Why negative study, whereas there was a positive study with the Lumithera? Perhaps the disease. There are differences between dry AMD and DME. Perhaps the wavelength of light in the DRCR Retina Network trial, we designed to emit 670 nanometers only, whereas the Valeda device gives 3 different wavelengths with 3 different effect and function. And the dosing, we gave twice a day, every day for the 4 months of study, whereas the dosing is very different with the dry AMD LightSight 3 therapy. So I think there are many different reasons why it worked in one and not in the other, but it stresses the importance of doing a clinical trial, very well-designed clinical trial, and having placebo arm, sham arm, and also looking at the differences in biology. So I think we'll hear more about it because it's non-invasive, right? It sure beats monthly injections or every other month injections, and the side effects, potential infection or endophthalmitis and so forth. So I think there is definitely a role for studying further of PBM.
I know a lot of retina specialists may not have heard of photobiomodulation before. Kwan, can you tell us, can we know or identify how it works? It's non-invasive, it's low light therapy. How do we know it's having a clinical effect?
Well, certainly that's a wonderful aspect that we not have the knowledge yet to know, and certainly we should know, and we should be able to learn in the future. At the moment, we do not know the exact mechanism as to how light affect the very structure of the retina and perhaps certain aspect in the body that will lead to that. We have hypothesized that perhaps the action of light here will be acting up on the retinal pigment epithelium, but we do not know for sure. So certainly we are looking further and deeper into the LightSight 3's result here, we can see what kind of changes perhaps we see on the various layers of the retina, but also perhaps we can perhaps either with this LightSight 3 study or other study in the future, we should look at biomarkers in the body. Yes, the light only go to the eye, but I suspect that that will have some potential effect too. And let's just say looking at how mitochondria react to this certain level, certain marker, that will help us. Because we definitely do not want people to, we do not want to consider therapy where it may by chance happen. So if we learn more and we see more and more positive result or negative result, we should learn to understand deeply how photobiomodulation actually can benefit or not into our patient. But certainly, Julie and Bob mentioned, all of us in the table here, we are clinician scientists. So any type of treatment that will decrease the burden and, as Julie pointed out, much improved in safety, that would be one of the accepted, I would think.
So this is very exciting. We had incredible results from the top-line data of the pivotal LightSight 3 study and a very engaging conversation about photobiomodulation therapy. We look forward to more data, and thank you again for joining us at Innovate 2022. We look forward to seeing you at our virtual meeting on June 4th for Innovate Retina. Thanks again.